This
keep studying
conference will now
this
be
process.
recorded.
Just remember, 2 months. 2 months of this book work is left. All right. So it's not going to get easier, but y'all can, power through it. It's 2 months. Right. 2 months ago it was Christmas. Like, just think about it like that. So the most of May is going to be review and test prep stuff. Go ahead and start working on test prep if you hadn't already. I know, like, EMT prep, medic test, all those little websites you can get on. I know EMT prep, you can break it down by section. Yeah. So you can look at respiratory, A&P, cardiac, whatever. You can break it down in sections. You can also do like a full test. It'll tell you what areas you need. Yep. So that's a perfect way to prepare for National Registry, because they set those questions up very similar to National Registry. So
yeah. Does anybody have any questions about the test that you just took?
Yeah, the heart. I don't understand the flow of the heart.
The flow of the heart.
Yeah, I'm struggling with that.
Okay. Does anyone else need review on the flow of the heart?
Yeah.
Yeah. Okay. I think I've heard a couple people kind of say it, so we can go over it some more.
I think that's in here.
I think it is too.
Yeah.
There's at least a diagram of a heart, so we can talk about it. One question that I think was the most missed question on this test was, where is bile formed?
Oh, yeah. Yes.
Does anybody know where it is? The liver. Yeah.
I know that because of
Another big question that was missed was the question about how your body excretes waste from it. Does anybody know the answer? Urinary. Right? Because that's how your body gets rid of most of the bad stuff in it, right?
There was one question like ventilation, but I thought ventilation was just breathing, but the answer was gas exchange.
Oh yeah. Yeah. So ventilation is technically the.
But the answer was like the gas exchange. That's right. I thought that was perfusion.
We can go through.
We can double check the question. Yeah. I don't know it off the top of my head.
Like the primary function of the respiratory system.
That's what the book said, right? Just taking in air.
Yeah, taking in.
Yeah.
That's what's supposed to be.
Cool. Yeah, I'll try to go through and find that question before we leave here today, and then I'll look at it, because it might just be an oddly worded question or something. I don't know.
If the doctor thought it was wrong, it's probably
wrong.
Yeah.
Yeah. But
oh, you got it?
Found it.
What does it say? Okay, so which of the following is the function of the respiratory system?
Oh no, that's the ventilation.
Ventilation and oxygenation.
It's somewhere around there, yeah.
It is somewhere around here. I know it.
Dang it. Where'd it go?
I know it's here.
I know.
Because I remembered second guessing it, and then I was like, I'm pretty sure it's gas exchange.
How far do you guys go out?
You're gonna go through it's gonna be the very last question that you
Right.
That would be annoying.
also with the pre-test, we print out all of those pre-tests, and we have them in our book. So if y'all come back on a week and you have questions, I can print those off. I can't print the regular test off for whatever reason that I build, which is kind of dumb. But I can print all the pre-tests. All your homework assignments are printed off and kept in our book. So if we come back and y'all want to review stuff over those, we can always go back and review that stuff too, because we have all of those.
Mm-hmm. And like I said the first day, if you guys have any questions about those pre-tests, please don't be afraid to speak up in class, because chances are if you have a question on it, somebody else has a question on it. So
yeah, we'll try to find that question.
Yeah, we'll
before
find
we
the
leave.
question. All right.
You ready?
Yeah. So chapter 7, this one's super fun, almost as fun as chapter 6. So we're gonna get through it. We have a Kahoots. This PowerPoint's a little bit longer just because there's a lot more information. They pull in information from chapter 6 for this one too. So there's just a lot to take in. So.
Just
All right.
kidding.
Just kidding. There we go. All right, so our objectives this week or today is going to be identify the difference between sympathetic and parasympathetic functions of the body. You guys remember we talked about that on Tuesday, whatever the day of class was last time. We're going to differentiate between a blood vessel problem and an electrical problem of the heart. We're going to review the cardiopulmonary system and identify shock and its causes. So you guys will see in one of the slides coming up, shock is kind of an umbrella term. There's a bunch of different types of shock. So it's going to be important to know each individual type and how they are causing the shock, okay? Yeah.
On that, would it be safe to say that every death is a shock death? You know what I mean?
You talking about every death is caused by some type of shock?
Yeah.
Right?
Yeah.
Yeah, whether it be like a heart attack issue or a pneumothorax or a septic issue.
Trauma.
Technically
bleeding
speaking,
out.
every
Yeah.
death would be considered a
Everything is
shock.
right?
Yeah. Shock kills you. What's another name for shock? Hypoperfusion. Okay, I'm glad. That's like the big one.
No company.
I'm ready for this thing today. I worked hard on it. I might just start pulling names and then asking questions. We'll see. I'm excited about this though. I shouldn't carry it though because you can probably hear it. All right, so here's the cell. The cell membrane protects and selectively allows water and other substances into the cell. I'm gonna warn you guys. I'm not very good at like all the cellular functions. Like what was it we were talking about the other day? And it was like synthesizing protein.
Yeah, synthesizing protein.
Yeah. So if you have any questions about this, please let me know and we will find out together because I'm gonna do my best, but I'm not good at the cell functions. All right, so we all know the mighty mitochondria, right? So converts glucose into ATP. So ATP is our energy. That's the fuel that our bodies use to function. Or adenosine triphosphate is the other word for it. All right, here you should have a picture of this in the book. I will say for those handouts that we gave you last class, I believe it's right before like the medical terminology part in the back of your book. I believe it's page 1300. If you guys go in there and just flip, it's just all of these pictures. So that's a good kind of reference point whenever we're pulling this stuff up, whenever you guys are filling out the little worksheets or even just studying, that's kind of a good resource to use. So here's the cell.
All the parts of
All the parts of the
the
cell.
cell.
All right, water in the cell. So cells need the correct balance of water to inside and outside. If there's too little of water, the cell dehydrates and dies. And if there's too much water, the cellular function is interrupted. So we all have like this perfect balance going on in our system all the time, hopefully. Does anybody know the term for that when everything's just happy and everything is where it needs to go? Homeostasis.
I was proud.
I like it. Proud of y'all. And then we have electrolytes. So that water also affects our electrolytes as well. Electrolytes are used in every function of our body. So our heart, our brain, our cells. Glucose is another big one. So without glucose, your cells don't survive. Your brain needs glucose. Your supply of insulin must match the body's glucose requirement. Where is insulin made? Pancreas. Good job. So the best way that I can kind of describe it, this picture is kind of small if you can't see, but insulin is the key for that glucose to get into the cell where it needs to be. So whenever we're talking about hyperglycemia, the problem is that the glucose is not getting into the cell for function. There's too much floating around on the outside. So they need insulin to kind of open that door and let that glucose into the cell so you can get that appropriate energy. Does that make sense? All right. So we have aerobic and anaerobic metabolism. I think I mentioned last class, the best way I can remember it is aerobic has air or oxygen. So whenever our cells are in an aerobic metabolism, you you create 32 ATP. That's energy, right? So the more energy, the better. And then whenever you're in anaerobic metabolism, I gotta sneeze. I got a
Bless you.
tickle in my nose. Sorry. It's just gonna go away. It doesn't want to do it. It don't help. It's gone. It's gone. See you later. It'll come back later. It's fine. All right. Anaerobic metabolism. That's without the oxygen. So if you can see in this little picture, little SpongeBob here, that only creates 2 ATP. So what does that lead to? A buildup of what? Lactic acid. Good job. Sad face.
For me, I've actually seen this picture with SpongeBob before.
Uh-huh.
It always makes me think of the audio clip of the kid from the Simpsons. It's like, I'm in danger.
Oh yeah. I'm in danger. That's funny. All right, so cellular or aerobic metabolism. You can see here in this picture. This came from your book. It has oxygen, glucose comes in, converts. If anyone memorizes the Krebs cycle on how that converts, kudos to you. I learned it for like 2 weeks, and then it was like, see ya. So with oxygen, we have an abundant amount of ATP. That is like prime. Our cells are metabolizing like they should. Here it is without oxygen. Comes through, does its little Krebs cycle stuff, creates lactic acid. You only get 2 energy, 2 ATP. That's a sad day. All right, so we have diseases that can alter the permeability of the membrane. What is permeability? Yeah, so how easy stuff can go in and out, right? So ineffective cell membranes can allow substances into the cell that shouldn't be there, or interfere with the regulation of water. Homeostasis. It's the answer to everything. It's either homeostasis, hypoperfusion, or shock. That's always the answer. So this is regulated in our brain. We have these little receptors. Hypothalamus. It's going to be in our
Those are
brain
yours.
stem.
There you go.
Yeah.
We don't need the neurologist judging us.
Yeah. If I really want to piss him off, it's the brain stupid. It's not though. It's really not. It's cool. He just thinks it's better than the heart, so we got problems, but it's fine. All right, so key structures, the hypothalamus and the medulla oblongata. So that sits right here in our brainstem. So any kind of brainstem dysfunction what kind of side effects or symptoms do you think you'll see with any kind of problems with that brainstem? I mean, maybe a seizure? No, not so much. I got the neurologist going. Okay. What was that over here?
The only things that are involuntary.
Okay, I heard something else. Speech, not so much the speech.
Involuntary.
The breathing, yeah. So involuntary stuff. So here is a picture model of your parasympathetic and your sympathetic. I'm going to use it. I like this thing. Ooh, Miranda, she's down in Austin. Can they unmute? Can you guys unmute?
Miranda, wakey, wakey, eggs and bakey.
Summoning Miranda.
You know, it figures our first pick would come from Austin.
Yeah.
We're just going to really test the limits here. Hey there, Miranda.
Okay, there it is. All right, Miranda. Here's your question. What does the parasympathetic nervous system, what does it do whenever it is activated?
Can you repeat that? There's so much feedback.
I can hear you like 6 times.
What does the parasympathetic nervous system, when it is activated, what does it do?
Calms the body?
Yeah, pretty much. It calms the body.
Thank you
calms the
for
body.
answering that 4 times. We appreciate it.
Yeah. So that's your rest and digest, right? So, okay. Isabel, what is your sympathetic?
It's the complete opposite.
Complete opposite. So what kind of vital signs are you going to see if somebody has a sympathetic response?
Like a high heart rate.
A high heart rate. Cool. I
Your
like
blood
it.
pressure goes up. Your heart rate
Yep.
goes up. You're just all excited, right?
All right, so we talked about this. I like the picture of the panda because usually you're running from a bear, but that one you're just laughing at. Yeah.
Did you have like you know how you say parasympathetic is rest and digest? Was
Mhm.
there anything to try to remember the sympathetic one?
See,
Ooh,
that's what you get.
Fight or flight.
Yeah,
Just
freaking-
fight or flight?
Yeah, fight or flight. Fight, flight, or freeze. I don't have anything special for sympathetic. We could think of one. Yeah.
I think there might be one, but it's not appropriate in most.
Well, I said one that wasn't appropriate for parasympathetic, so if you got one. All right, so yes, reduces heart rate and blood pressure whenever this is activated. Is there a better word for that when I say activated? No. Okay. And here's our sympathetic, epi and norepi. It enhances ability to protect itself. So if you're running from a bear in the woods, your heart rate's going to go up, your pupils are going to dilate. All right, this is the cute little picture that I found. I had to put it on here. It's a little oxygen. So we're going to talk about the cardiopulmonary system.
Didn't work.
Oh,
Now I freaking
now
did
it's
it.
not even responding. Now you done it.
Yeah, I don't know why I do. Every time I freaking touch something, it breaks.
Oh my goodness.
Bro, if this freaking PowerPoint.
Well, we can brainstorm
disintegrate-
about fun ways to remember the sympathetic nervous system. You got the question? Oh, perfect. Okay.
So here's the question. And I even second guessed it, but I got it.
Huh?
Split the screen for sure.
So the question was the basic function of the pulmonary system that is known as ventilation involves circulation of blood, not that one, the movement of gases to and from the alveoli, the movement of oxygen and nutrients into the body's tissues.
So I remember there's more than just oxygen, right? So that's why I was like, I think.
Wake up.
Is that the question, Mike?
Yeah, I think it's. I read it again.
Okay, so the basic function of the pulmonary system that is known as ventilation
Hold on.
involves the movement of gases to and from. What was the one that y'all thought it would be? The movement of oxygen and nutrients.
But there's more than oxygen being moved in there, isn't there?
Yeah, well,
That's
so
what I read.
I think the nutrients maybe might be like the deciding factor. I'm not 100% sure.
Should be over there.
Other side.
I almost went the same too. I was like going that way.
Bro, if these PowerPoints don't work. Is it not working?
Oh, now it's buffering.
It says it's loading.
I only got that. I literally got like some of these.
If you guys need to go to the bathroom or anything, feel free.
I haven't even been really started.
It's always something with the technology. It's never the same thing twice. That's what I've noticed.
Yeah.
It's always something different. Miranda wants to know if they can email or we can email a copy of the pretest. Can they pull up the pretest and review them? Because I don't know if we can save it as like a file.
Well, this
one
is just too big.
I mean, we can print it off, but I don't think it'd have the answers on it. We'll figure it out. Miranda, we will let you know because I got to figure out how to print that off.
What is happening?
Maybe just eject this and then try it again.
I don't know why every time you open it,
We can try plugging it into something else.
We ain't got nothing else to plug it into.
Started the lift, right? Like just started it and do this. They went like 10 feet out. Who was on that? I almost finished that. That's why.
All right.
I wasn't in the same dose. I would not.
All right, pull it out.
Oh, the night before you guys done a training.
This is like super hot.
You should be
Should I
able
try
to.
plugging it in here?
it's not plugged in the computer.
Oh,
I mean,
You should be able to.
try this.
There's a USB right here too, CJ.
Yeah, I don't know if it's wide enough to get in that slot. Why does the screen still look good?
You gotta earn one. Really? Yeah.
oh, you brought stuff.
$20, you know? 100?
I mean, we'll take $20 and 100% on your next test. All right.
I printed these out for anyone.
Oh, perfect.
Yeah.
Cool. You can hand them out.
Yeah.
How big's the next time?
I don't know. Huh?
All right, if you're struggling with the
50,
blood flow of the heart,
probably.
this should help. If you're kind of dumb like me and the whole like figure 8 inside the heart doesn't work for you, I like to look at it in a circular fashion, and it kind of just helps me remember it. Who would like one of these?
I was just gonna hand them all out.
I don't know why, but I'm confused.
Will you hand those back?
Left and right.
All right.
Okay,
But
so it's
he-
opposite.
Can you
Yeah.
see
Remember
it on your phone, CJ?
Yeah, just look down.
That's what I did.
Everything is your
Yes, I know.
Mhm, it's
Now-
hard.
Now that you said that, because I was all trying to mirror it when I was taking the test. And I was
Oh,
like,
yeah.
that ain't right.
Yeah, the patient.
All right. Let's
Oh, it
try
works.
this again.
Okay, is everybody back? Anybody missing? Aaron's. All right, we're just waiting for Aaron.
What? Will it scroll?
Thank you.
All
Everybody
right.
got one that wanted
I
one?
was just kidding.
It's all right. We'll,
I'll tap. It's like the fix all hold out push tap.
yeah. I can't even figure that out most of the time. So
It just changes screens and whatever you were doing.
You might have to just restart.
I went to 2 years of tech school. Alt tab. Or alt control and English.
all right, cameras on, PowerPoint's on.
Yeah.
All right. Is Aaron back? Awesome. Okay, everybody's back. All right, now we're actually going to go over the cardiopulmonary system. So they work together to bring oxygen to the body, right? So let's go through kind of the flow, right? So we breathe oxygen in. Where does it go first? Nose, mouth, okay. And then your pharynx, right? Where does it go after here? Yeah, so there's an epiglottis. I like it. I like using these. So it goes through that, past the epiglottis, right? What does our epiglottis do? Okay. It flaps. It keeps food where it needs to go, air where it needs to go. Okay, then it goes into what structure is this right here? Trachea. Okay, and then it goes into what? Okay, bronchi, bronchioles. Then what? The alveoli. And then what happens at the alveoli? Gas exchange. That blood that's getting oxygenated goes back into what part of your heart? It is oxygenated blood from your lungs.
No, remember, your oxygenated blood from your lungs goes into what part of your heart?
Yep.
Left atrium.
Left atria. It does go onto your red blood cells. That's what carries it. You're not wrong. But it goes into your left atria. Then where? Left ventricle. Then from there, where does it go? Yeah, to the rest of the body, right?
And deoxygenated blood goes where? When it comes back into your heart? Huh?
And that's the one that got me.
Think higher.
Right
Right atrium?
Right atrium.
Or yeah, sorry. I when you said that, I thought you said ventricles. Sorry. Sorry.
Okay.
That was my fault.
So I
right
highly
atrium, right ventricle.
recommend that you guys review these structures that your air's got to go in order. Okay. I will say that again. I highly recommend you review the order of which oxygen comes into the lungs. All right. So we have our bronchial tree. We just went over this. This is just a picture of everything we just went over. So you have your larynx, your voice box. We had to Google it because we kept seeing hypopharynx. Your hypopharynx is like that spot right above your epiglottis. The epiglottis is like that dividing factor. So if you remember, your larynx is kind of like where that the lower airway starts, and then your epiglottitis, and then your hypopharynx is here. So voice box. And then you have your ravioles or your alveoli. So this is a pretty good picture. It kind of shows where those capillaries sit, so where that gas exchange happens. And these are teeny, teeny, tiny. They're not like huge. So, does anybody remember the name of whenever one of these, or whenever these collapse? It was on one of the Cahoots last week or last class. Atelectasis. All right, so your patient needs an open airway, right? So what's a good way to assess for an open or patent airway?
Just it's really simple.
It's very simple.
Think simpler.
Yeah, you can
Think simpler.
You're talking to him?
Hey, how are you?
talking.
Yes. Good.
Good. What's your name?
Amanda.
Does she have a patent airway?
Yes.
Yeah.
It's that simple.
All right. So upper airway obstructions are very common, or are common. There's some things that can cause them. So we have foreign bodies, obviously, especially in little kids. Foreign bodies are big. Infection, trauma, all that kind of stuff. What are some signs and symptoms of an upper airway obstruction? We learned about this in our CPR class. Not so much wheezing, gasping. Okay. Wheezing is a lower airway problem. Can't talk. Good. Stridor, that's what I wanted to hear. What is stridor? Okay. Yeah, so there's an obstruction. There's a little bit of air going past that obstruction. There's a certain stridor is like defining that noise that you hear. So it's gonna sound like that's the best I can do.
It's gonna sound like a little whistle.
It's gonna, yeah, it can sound like a whistle. So that's an upper airway obstruction. All right, so the lungs, lower airway. What structure starts our lower airway? There's a structure right here. Larynx, lower airway. So our tidal volume, these kind of like, what's the word I'm looking for? Calculations. They're important to know for the National Registry test. Like if you think about it, you can be like, yeah, that makes sense that it's tidal volume. But to know what the actual like terms are that go into these calculations is going to be important.
They are also going to be important on your test. So know how to calculate these things.
What machine, or how do you measure how much
volume
you're getting?
So with tidal volume, it comes down to like an average. It's like 4, 6, or 8 milliliters per kilogram of like your ideal body weight. Okay. So then you can count your respiratory rate, and that's how you get your minute volume. So tidal volume is a calculation. The actual calculation for tidal volume isn't going to be on your test.
No.
But knowing what tidal volume is will definitely be there.
It might tell you that you have a tidal volume of X amount and a respiratory rate of X amount, and might ask you to find out what the minute volume is, or vice versa. It might tell you what the respiratory rate and the minute volume is, and try to calculate what the tidal volume is. So,
So the reason that whenever you're thinking about tidal volume in ideal body weight is because people's airways don't change sizes just because they're big or small. So women have a little bit different of a size. It's based on your height. There's another calculation for that I can't think off the top of my head. It's like 45 plus something.
yeah.
I can't remember now. But you don't need to know all that right now. Just know what a tidal volume is. So the volume of air moved with each breath, and then how to figure out minute volume. Okay. Any questions on that? A lot of questions.
Again, it's
Throw 'em
not
at
going to
me.
be, we're not going to tell you that you have a 40-kilogram patient and, try to figure out their tidal volume. Just know what tidal volume is and know how to calculate a minute volume. All right.
So if you want to take a picture of this, write it down, whatever. It's going to be beneficial for you.
Wait, get back on. You Carly?
I got it.
Got it? Okay. All right. So this is kind of what I'm talking about. The size doesn't matter, right? So if you look at this patient and you look at this patient, what's big about what's the biggest thing you see with the size of like their lungs? It's the same. So that's important to think about whenever you're treating patients, because their airway sizes don't change. And that's why we go off of ideal body weight for the airway stuff. So any decrease in tidal volume or respiratory rate decreases minute volume. That's kind of like right? Anytime something interferes with the minute volume, that is going to be respiratory dysfunction. So we have different levels of respiratory dysfunction. You have respiratory distress, you have respiratory failure, thank you, and then respiratory arrest. Okay. Sad day. Him's lungs are chained. All right. So respirations are controlled in the brain by the medulla oblongata. Hopefully I'm saying this right, Calvin. All right. So any event impacting function of the medulla oblongata can affect minute volume, because where does our medulla oblongata sit? In the brain stem. Okay, so infection, drugs, toxins, trauma. So you can have a disruption of pressure. So it's our lungs and ventilations are
I'm laughing at Calvin.
okay.
Sorry.
It's a negative pressure system, right? So whenever there is any kind of disruption in this pressure, our breathing is going to be affected. So a pneumothorax, is there a picture of a pneumothorax up here? Yeah, so this far left one, this cavity right here.
It's kind of hard to see.
Yeah, it is hard to see.
But
this is filled with air.
Do you see how this lobe of the lung is smaller than this lobe of the lung? Right? Because what's happening? That air is accumulating in that pleural space and collapsing that lung, right? That's why whenever we talk about it, we say, oh, they have a collapsed lung, right? Because that air is now allowing that expansion of that lobe of that lung, right?
Mm-hmm. And it's crushing what sits right here.
What sits right up here?
The heart. So it's going to crush your heart. And then the only way to fix that is to release that air. And you can't do it unless you stick a needle in somebody's chest or a chest tube, or you got to poke a hole in them.
It's a big needle.
It is. It's like this long. All right. So then we can have disruption of the lung tissue. And remember, most patients don't normally get just one of these things, right? So they can have like a pressure problem and the disruption of their lung tissue. So trauma or medical problems can cause disruption of that lung tissue. If you think about like pulmonary contusions and stuff like that. Which is, what's a contusion? It's a bruise. Yeah. It's just another fancy name for bruise. So less oxygen gets in, which means less carbon dioxide is going to get out. You're not breathing. What is reduced? Oxygen level. Minute volume is going to be reduced, right? Because you're not taking as deep of breaths in. You're not breathing at a sufficient rate. These are terms that you guys, especially hypoxia, you guys are going to be very familiar with. So hypoxia is low oxygen, right? So hypo, low oxygen. And then high carbon dioxide levels is hypercapnia. As an EMT basic, you guys aren't allowed to monitor end tidal. But whenever you start getting a little bit further, you guys will learn that this is a very important thing, is your carbon dioxide levels.
We're not?
The end tidal CO2, they're not, no, it's an advanced skill. Yeah. I think they just put it into advanced, didn't they? Like a year ago?
Yeah, I was about to say it's a recent development in an advanced skill. Before that, it was just a paramedic skill.
Yeah. But if you want to learn it, it's a good thing to learn. All right, so respiratory compensation. Whenever we talk about compensation, is our body's way of trying to maintain that homeostasis, right? We want everything to be happy, so it's going to start compensating one way or another. So our little chemoreceptors, they hang out here in the medulla oblongata, the carotid bodies, and then the aortic bodies. They actually detect our oxygen levels, changing oxygen levels and carbon dioxide levels, and then it tells your body like, hey, you need to breathe more, you need to breathe less, you need to take deeper breaths. So that's kind of where all that comes from. The brain's trying to control everything. So we talked about the components of blood. I believe you guys had a test question about this. Which part of the blood is more than half of the components? Plasma. Good. And that's the liquid part of our blood. We have our red blood cells, which contain that hemoglobin that Aaron was talking about. That oxygen hangs onto that hemoglobin, and that's how it gets where it needs to go. We have our white blood cells. What's another name for white blood cell? Leukocytes. And then we have our platelets, which form clots. There's different pressures in the blood. So our plasma oncotic pressure, the proteins in plasma attract water away from our around. Did I typo that? Proteins in plasma attract water away from and around cells. It's supposed to say and. I'm sorry. Apparently I can't type either. So, and pull it into the bloodstream. And then water pushed back out of blood vessels towards cells is the hydrostatic pressure. So any kind of problems with those proteins are going to cause an imbalance. Here's a little kind of visual. I don't think this one's in your guys' book, but it kind of goes back and forth, right? What do you think you'll see whenever there's a dysfunction in this and that water's on the outside? Edema. Mm-hmm. So we have like this happy little homeostasis, right? So without enough blood, oxygen, and carbon dioxide, without enough blood, carbon and oxygen. I'm going to go home.
Without enough blood, oxygen, and carbon dioxide.
So there's a bunch of things that can cause blood dysfunction, right? So we have anemia, we have bleeding, dehydration, liver failure. So whenever our stuff's not being properly moved around, what is not being maintained? Your oxygen, homeostasis. Thank you. All right, so we got our little blood vessels. So arteries carry blood which way? Away from the heart. And veins go where?
And what is the only difference between?
I like it. All right, so
I'm gonna ask every time because that confuses the crap out of folks.
Yeah. Me included. So we got these little precapillary sphincters. This is where gas exchange happens, is right here in the capillary. And I just like saying the word sphincter because it's fun. But they actually help like flow, the blood flow. So they'll open and close, open and close. All right, so our blood vessels, they take the oxygenated blood where it needs to go. And they take the deoxygenated blood as well. The gas exchange takes place. We just talked about this. And then returns blood to lungs. So it's just a big happy circle. You're going to see this picture a couple of times. I just feel like it's a good visual of like how that gas exchange happens at the alveoli, the little ravioli. So CO2, we breathe it out. A buildup of CO2 is called what? Too much? Hypercapnia. Good job. So this gas exchange, lungs, here it is in our little vessels. So our blood vessel pressure. So peripherally and more centrally. Most of the time whenever we're talking about like a dysfunction of this, it is like peripherally. So our vessels change diameter to kind of assist our body in maintaining that positive, like good pressure, right? So whenever they squeeze down, it's called vasoconstriction. Whenever they open up too big or open up, it's called vasodilation, right? So whenever we're talking about vaso, that's talking about that vessel. So what are some things that can cause vasodilation? Some medications, yeah.
So
I heard,
the fight or flight is going to be the opposite, right?
yeah. So whenever our bodies go into shock and they're trying to compensate, we do this cool little thing called shunting. So our vessels actually constrict. So it's vasoconstriction, and that is forcing more blood to go to our main organs because our body's trying to preserve itself, right? So vasoconstriction brings blood in. Vasodilation helps move that blood out. Does that make sense? All right, so we have loss of tone. There's a few things that can cause loss of tone. Whenever we're talking about tone, it's like those vessels are just going to dilate. So whenever they dilate, one thing you're going to see is that blood pressure is going to go down, right? Because there's not a pressure system in there, so that blood pressure is going to drop. So we talked about some causes. So I heard medication. What was another one? We talked about the sympathetic, but it's parasympathetic. Yeah. Anything else? Everybody's favorite chapter. Trauma. So any kind of trauma. So like a spinal cord, we were talking about those dermatomes. That can cause loss of tone as well. And then we'll talk about rectal tone.
Good tone, no blood.
Good tone, no blood. Good tone, no blood. Here's a bigger picture. Probably easier for y'all to see than that other one. So normal vessel, dilated vessel. What's it called when they do this? Vasodilation. Good.
You think that blood's moving around like it's supposed to? No.
Mm-mm. Ain't no pressure behind it. Another big one is allergic reaction. So if someone has anaphylaxis or a bad allergic reaction, their blood pressure is actually going to go down because you get that vasodilation and everything goes whoosh, and you lose your blood pressure. Usually your heart rate comes up. Does anybody know how to treat anaphylaxis? Epi. Yeah. EpiPen. Y'all can use the EpiPen. Same. Apparently, if I get stung by a bee, my body don't like me or something. I don't know. So excessive permeability. We talked about permeability, being able to move stuff across that membrane in the cell, right? So capillaries leak fluids out of their walls and then caused by sepsis. So whenever we're dealing with somebody with sepsis, I don't know if you guys remember me talking about like the vital signs, how some vital signs can kind of lead you towards like a bad infection. This is where that comes in. So like sepsis, you're going to have a low blood pressure, a higher heart rate. And so knowing this part of it is going to help you kind of picture in your head like what's going on with your patient. Is leaky. Sad. Blah.
Sad vessel.
Sad vessel. All right. So hypertension means what? If it's hyper, high blood pressure. Good. So we have our systemic vascular resistance, which is basically that pressure inside those vessels. So we can have a lot of conditions that lead to abnormal constriction, but that heart pumps a lot harder than it needs to, and our blood pressure goes shoop. You guys have all heard stroke and vascular disease, hypertension. If you guys have ever been to a doctor, I'm sure you've seen like the pictures on the wall. Usually they have one. So what do you think? So hypertension, you have increased vascular resistance, right? That's a way. So your heart's beating against that vessel, those vessels. What do you think happens to your heart? It works hard. And the heart is a muscle, right? So what's going to happen to our left ventricle? Because it's pushing against all of that, right? It strains. And what do muscles do when you work out a lot? They get big, right? What did you say? Okay. All right. I didn't hear anything, I swear. All right, so then we have our loss of regulation. Our chemical messengers tell the blood vessels when to constrict and dilate. So the lack of the sympathetic response can cause shock. So like if your parasympathetic is like in overdrive, that can cause shock, right? So it causes your heart rate to go down. Your body can't compensate like it normally does. Is this going to do this again? Bathroom break.
That's a CJ thing.
You could do it.
Yeah, froze again.
I don't.
It's never the same technology problem twice. Huh? I know, it's always something different. It's stupid.
Just keep
It's
freaking
irritating.
kicking sour PowerPoint.
They can cramp though.
You're over here. All right, over here.
Ask for not good for it. Steroids are immunosuppressants. You know, immune system suppressant not work.
I'm telling you, Calvin should be teaching this class.
No, definitely not. You get that smile off your
Did I do okay talking about the hypothalamus, Calvin?
Yeah, it's
Good.
responsible for 4 F's: feeding, fighting, flighting, and
All right, I like that. I'm going to try and remember that. Feeding, fighting, flighting, and mating. That's not an oh. Oh, I was like, that's an M. I like it. I'm probably going to say that, just so you know. I'm going to do it.
I was seeing myself up and
Huh? The loss of sympathetic tone? No. Yeah.
This is the other one. You were still before the heart, right?
Yeah, it was before the heart.
I would say.
Just past that.
Calvin, that's the hypothalamus. Just the hypothalamus. Thanks.
When you buy it, so
It has flashcards it makes for you, and it'll diagnose where you're at. You'll take a
Cool.
exam, and it'll tell you what your last year and so it helps with that. But the only problem is you can only take the quizzes so you want to save it for the time you really want.
That's okay.
Once a month.
Okay. And then.
Yeah, it'll go over, like, it breaks it down into even the subsections. So say like you're just having issues with the heart, so it'll give you study examples. The book though, I got that one. It was $20. I bought it.
That's not stable.
And it's awesome. It condenses everything down. Helps you remember. You're right.
I just learned this.
I think it would be in a dozer. It would
Where did my clicker go?
I thought the third one was feast.
Is it feeding? Where's my? Let's confirm with the neurologist in the room. Feasting?
Is it feasting or freezing?
Feeding. It's feeding.
Speaking of feeding, is it food?
Whoever took a picture of that, retake a picture of that. You have to retake the picture. Okay, I think everybody's back.
All right.
Sorry about the technology issues. It's always something. It's never the same thing twice.
Except for tonight. It's been the same thing 6 times.
Yeah. So I just learned this fun little tidbit of information. I'm going to share it with y'all. The hypothalamus, which is where? Brainstem. It's responsible for the 4 F's: fighting, flighting, feeding, and mating. Yeah. All right. So the heart. This is my favorite. I love the heart. There's one here. If y'all want to look at this, we can pass it around. It's kind of cool. You can take this little top off, and it shows you all the stuffs. It's neat. All right. So average stroke volume, about 70 mLs of blood per contraction. So stroke volume, output, same thing. So our stroke volume is based on a couple little things. We have the preload, which is the amount of blood returning to the heart. What part of the heart is the blood returning to? Right atrium, right? So it's right up in here. If you take this off, you can see it. It's right up in here, Austin. All right, then we have our contractility, which is how hard the heart squeezes. And then we have our afterload. So that's the pressure that our left ventricle has to pump against to get blood to where it needs to go, right? So we were talking about that. So another good formula to know is our stroke volume times beats per minute is our cardiac output. Obviously, we don't have a super good way of measuring this in the field. I don't really have an ultrasound. I think that's how that's measured, is an ultrasound. And then, so if you slow down the heart rate, you decrease the stroke volume, so reduce cardiac output, right? So the best way I can like mental image this for you guys that works for me is if you have like a cup under some flowing water, if it's really slow and you're trying to fill a bucket, it's going to take a little while to fill that bucket, right? If you're going really slow. If it's really fast, you're going to fill that pool, but it's also, you're not getting as much in the cup every time, right? So a very fast heart rate also reduces cardiac output. So you're just not getting that volume that you need to get. I just like this picture. I think it's a good mental image of where blood is going. So that preload is going into our right atria, comes down, or afterload, cardiac output from the left ventricle, and then afterload. All right, so pediatric compensation, our little kiddos, they compensate a little bit differently than adults. So whenever we're talking about kids, they're going to relate. Oh my goodness, I cannot talk. I think I'm had a stroke today. Y'all can learn about stroke assessments tonight. So rely on heart rate for the compensation, whereas adults use blood pressure to compensate. So if you are monitoring a kid and their blood pressure is now dropped, you missed something else, because blood pressure is one of the last things you'll see in kids for shock. Heart dysfunction. So mechanical problems of the heart, physical trauma, right? So we can get a good blow to the chest. Squeezing forces. So one thing that we were talking about earlier that can affect the squeezing forces would be what? Collapsed lung. Yep. And then we have cell death. Another name for cell death is infarction. That's an important word to know. Whenever we're talking about the other word for a heart attack, does anybody know the name for that? Yeah, myocardial infarction. So what is that telling you? If you hear the word myocardial infarction, let's break down that word. Myocardial, so muscle of the heart, and infarction, death. Okay. So this is a little picture. It's supposed to tell you, like, show you what a heart attack looks like, right? So one of these little vessels here, what are these arteries called? Coronary arteries. It stops, there's a clot in there somewhere or something causing it to not get blood flow where it needs to go. And that little purple part is that area that is not getting blood flow, and that muscle starts to die. That is a heart attack. What is this?
The heart working too much.
It's kind of hard to see around it. So there's a sac that surrounds your heart here. Yeah, and it's filling with fluid. So tamponade is what that is.
Does anybody know how to fix this? Pulp Fiction. Anybody ever seen Pulp Fiction? No, I'm just old. That freaking big old giant needle in the chest.
We can't do that in the field.
Yeah, we can't do that. I mean, we can stick the needle in the lung. We just can't do it in the heart. Something about we go too deep and puncture things or whatever.
Yeah. So this fluid needs to be released, but we can't do that. So that's yeah. Oopsie. And then here's that tension pneumothorax that we were talking about. So the pleural space fills with the air or blood or air and blood, and it squishes your lung and it squeezes your heart. So that's affecting your heart's ability to pump. And then the heart also has its electrical problems. The cool thing about the heart's electrical problems compared to the brain's electrical problems is you can shock the heart. You can't shock the brain. So the heart's cooler.
Is brain guy in here?
Brain guy's not even in here. You didn't even hear me say that, dang it. All right, so if you guys remember the heart's electrical system, we talked about it on Tuesday. What's that little pacemaker that sits at the top of our heart called? What did you say? Sinoatrial node. So the SA node. So that's part of the electrical system, right? So each of our heart cells are talking to each other. They have their own little electrical system that tells the heart to beat. If there is a problem in that electrical system, you can kind of see the nodes here. It can cause unorganized rhythms, right? So what's one that you learned in CPR class that we can shock? Fibrillation, ventricular fibrillation, and VTAC. So ventricular tachycardia. So those are not, most of the time, atrial or ventricular fibrillation is never a perfusing rhythm. It cannot perfuse.
They will always be dead.
They will be dead. Sometimes you can have electrical abnormalities where they're in VTAC, but they're sitting there talking to you. So that's one that's kind of funky.
We have had that. And we were talking about this earlier. Me and Becca ran a call on a young lady that called for altered mental status. She was sitting in VTAC, and Becca thought that I was messing with the monitor. And she was sitting there talking to us, just chilling on the stretcher, just sitting there in VTAC. So it kind of makes your butthole go whoop. But no, we were EMTs at the time.
EMTs at the time.
Yep.
It sucked because we were almost done with paramedic school, so we were sitting there like, I know exactly how to treat this, but I can't. Yeah. All right. So the cardiopulmonary system, it's a big happy family, right? That little picture where he's like, I got you something. Thanks. I'm going to share it with everybody. They have to work together. This, I don't know why perfusion is Q, but this here, the VQ match, is talking about ventilation and perfusion. So you guys kind of got the what's the word I'm looking for? Yeah, the idea of it down. These are just the words that go with like being able to breathe and being able to do that gas exchange in your lungs. So ventilation, VQ match. I'm not saying that this is going to be on your test, but it's probably a really good thing to know. So ventilation, V, perfusion is Q. Don't know why it's Q. And they need to work together. So whenever there is something wrong with either one of those systems, you get something called a VQ mismatch. So that's it. Shock. So as we talked about earlier, pretty much every death is attributed to some kind of shock. So perfusion is big. I can hear myself. Oh, okay. Oh, yeah. So hypoperfusion, shock, same thing, right? They're interchangeable. Ultimately, the result of shock is your organs don't get the stuff that they need, and that perfusion and cellular respiration, everything gets messed up, right? So here's our different types of shock. That's really fuzzy. So we have hypovolemic, which means what?
Low volume.
Low volume. Okay. What can cause low volume?
Dehydration.
Bleeding.
Dehydration, bleeding, injury causes bleeding.
Vomiting, diarrhea.
Vomiting, diarrhea. We have cardiogenic shock. What could cause cardiogenic shock? The heart failing, yeah. So myocardial infarction. We have obstructive shock, so something stopping that heart from beating. What can cause obstructive shock? Tension, pneumo, obstructive, right? So something's pushing on that heart. And then we have distributive shock. So you can kind of see where these like arrows are pointing. This is pointing towards the heart. It's a heart problem. Obstructive, there's something stopping that heart from beating out where it needs to go. And then you have your distributive, which is your vessels. So there's a problem with your vessels, whether it's that vasodilation, you got leaky vessels from like sepsis. That's going to be a distributive shock. So perfusion, everybody's happy whenever we're perfused. We know hypoperfusion is shock and can result in death. We talked about these. Hypovolemic is that low blood volume. Distributive, low blood vessel tone. Cardiogenic, the heart fails to pump. And then the obstructive, that blood cannot flow. I think there's another picture. So we were talking about like these are kind of umbrella terms for other types of shock. It can get a little bit confusing. So as long as you know like the four main, you can kind of branch those off into their own different kinds of shocks. So neurogenic shock, septic shock, anaphylactic shock, those are all just subcategories of these four main types. Does that make sense to everybody? It can get really confusing whenever you start taking a test and you're like, person's having an allergic reaction. What kind of shock are they in? You're going to say anaphylactic, but the answer would be what? distributive. Here's just more reiteration that there's different classifications. I don't think you guys can maybe see, you can see it well on that screen. This one, not so much. So distributive, leaky pipes, septic, neurogenic, anaphylactic, adrenal crisis can also cause a distributive shock. You have an obstructive, so a massive PE. What's a PE? Yeah, pulmonary embolism, which is what? Pulmonary, so where is it? In the lungs. Embolism is blood clot in the lungs. Tension pneumo. We have cardiac tamponade, constrictive pericarditis. So what is pericarditis? Pericardium. Yeah. So itis, remember, is inflammation. And then you have your cardiogenic shock, so myopathic, which is ischemic. What's the difference between ischemia and infarct? Yes. So ischemia is the lack of that oxygen and blood flow. Infarct is the actual death that occurs. And then the last one is arrhythmic, mechanical, valvular. That's all under your cardiogenic. So our bodies, a happy, healthy body is going to try and compensate whenever something goes wrong, right? We have like our own little self-preservation systems that go on. So signs of compensation. So your patient is sick, but they're still compensating. I will say that whenever we start going into these assessments next week, it's going to be really important to do good assessments, because I have a firm belief that your patients don't just suddenly die and suddenly do this. We suddenly forget to notice. So if that makes sense.
It makes
Okay,
sense.
it sounded funny when
That
I
means
said
you
it.
missed something
You miss
along the
something.
way.
Patients
right?
don't just die like that most times. There's usually something that you miss. So whenever we start doing these assessments, these are good things to kind of keep in mind as you're doing those assessments. And the more assessments you do on normal, happy, healthy people, the easier it's going to be for you guys to recognize whenever there's something wrong with them.
But what we also need to understand in this process is what's normal for you might not be normal for somebody else, right? So that's where the assessment process comes in. So a perfect example of that is the other night I ran on a young lady whose heart rate was 45. Is that normal? So I had to go inside her house because she said she kept a running tally of all of her vitals because she took them every day. I went inside of her house. I looked at that sheet. Her heart rate always sits right around 45. Right? That's her normal. Mm-hmm. But without that proper assessment on my end, I'm either shocking the piss out of her or giving her medication to try to get her heart rate back up. Right? Because that's abnormal. Right? So thorough assessments is 90% of what you're going to do. And you know, that's what's going to push your patient, whether you're going to treat them or if that's just normal for them.
It's also to be a good history taker, to try to figure out what's going on before you get super excited. I mean, Chad's could have easily started pushing medications that increase that person's heart rate. It's not going to help him make damn. It's probably actually going to hurt him. But according to everything that we're taught in school, he's doing the right thing.
Mm-hmm. Yeah. So obviously his patient was compensating some way or another, right? So she had normal mental status. How would you assess the mental status of a patient? Conversation. Yeah. So, hey, what's your name?
Bob.
Hi, Bob.
Hey.
How is this person related to you?
This one?
Mm-hmm.
She's my wife.
Okay. Where are we at right now?
This goddamn crusty building.
Okay. Why am I here? You called 911. Why am I here?
Well, I don't know. I don't call 911, so.
Oh, okay. So I just assessed his mental status. So does he know who he is? Does he know where he's at? Does he know what happened? First release time. What around the time, like you could be like, hey, what year is it? What month are we in? Those kinds of things.
So A&O times 4. Does anybody know what that means? All right. Does anybody know what alert and orient? What are we looking for when we say, or whenever we say that? There's 4 categories: person, place, time, event. So that's what you're looking for as part of your mental assessment, right? You can have somebody that's alert to those things and not know, not be in a good mental status, but that's a good place to start, right? And that's what she just did. Person, place, time, event.
Mhm. And some people just have the same questions that they ask everybody. I always recommend doing something like that just so you kind of get the muscle memory of like, hey, I'm asking these questions, I'm asking these questions. As you get more experience under your belt, you can kind of do that stuff without having to ask, who's the president? What year is it? How many quarters in a dollar? Some people remember questions like that, and I don't think it's a bad thing, and then you can kind of progress from there.
Unless you're in front of the sheriff's department cameras, then ask all the questions
Yeah.
because you're on film.
Mhm.
So
let's talk about this capillary refill time. What is that? Okay. Yeah, so the time it takes for your blood to refill. It's already 7?
Yeah.
Holy monkeys. All right, so you squeeze a finger. You can do it to yourself right now. Squeeze the finger turns white. How many seconds does it take for that to come back to a pink color? Good job. So, decompensation for adults. When they're decompensating, altered mental status is a big one. So altered mental status can be anywhere where they're confused to unresponsive. That's kind of also an umbrella term, is altered mental status. And then decreased blood pressure. Whenever we're, as adults, whenever we're done compensating, your blood pressure is going to be like, all right, I'm done. I'm no longer compensating. See you later. And then we have irreversible shock. There's an alien in here. It's okay. And then we have irreversible shock. So that's whenever it's irreversible, right? Patient death commonly follows. So here's our fluid balance. We are 60% water. So drink your water. Intracellular, 70%, intravascular, 5%, and interstitial is 25%. So what does intravascular mean? The vascular. So intra. So inter means in, right? So intra means out. So outside the vasculature, only 5%. Interstitial is what? Inside the vessels, right? In between. And then intracellular, in our actual cells. So brain and kidneys, this was a question on your guys' last test. The kidneys regulate that function, right? So thirst and elimination of excess fluid. And then your plasma proteins pull fluid into the bloodstream. And then the capillary the cell membrane and the permeability regulates the flow in and out. So it's all working together so we have that fluid where it needs to go. So disruptions in our fluid balance. We talked about the dehydration. Somebody said that earlier. A few people said that earlier, actually. So total water volume is decreased. That can be caused from vomiting, diarrhea, what have you. Not drinking enough water, not eating enough food. That can cause dehydration. And then poor fluid distribution. So what is this right here? What is this called? Edema. But it is pitting, yes. So whenever you push in on it, the little thing stays. With it being in the lower extremities like this, it's also referred to as pedal edema. Here's the nervous system. Oh boy. So brain and spinal cord are well protected by bone and muscle, right? So we have our little spine, protects our spinal cord. We have multiple protective layers on our spinal cord as well. So our meninges, and then our CSF fluid or cerebral spinal fluid. If somebody has meningitis, what does that mean? Yeah, inflammation of the meninges. Here are the layers. So, duramater, I think that's how you say it. Duramater.
I guess it depends on who you. Mater?
Mater?
Like toe mater?
All right.
Yeah.
I do know that it means tough mother in Latin, so that's pretty cool. Arachnoid mater. Like the spider.
We
Looks
from
like-
the south. We say dirt matter.
And then your paya. All right, cool. Yeah. So there's this happy little balance that sits in our brains of cerebral spinal fluid, brain tissue, blood. If any of that stuff's disrupted, we get mad.
Big mad.
Our brains get mad. So nervous system dysfunction, we have trauma, which can be a lot of problems, right? So we were talking about those like loss of tones too, right? So what kind of shock whenever, say I was to break my back right now and I severed part of my spinal cord and my blood pressure would tanked. What kind of shock is that? Nope, it's a pressure problem. Because it's not with my heart. Distributive. So it's not distributing where it needs to go. So then we have our medical dysfunction, so our strokes, diseases, infection. We talked about meningitis, encephalitis, and then hypoglycemia is a big one, right? Because our brain needs glucose to function. Whenever that glucose is gone, our brains are like, see you later, and then things happen. Bad things happen. What's this? Is it a stroke? How do you know?
What can mimic strokes?
What's the most common mimic of strokes?
Yeah, the most common mimic of strokes.
Diabetic emergency.
Hypoglycemia.
Yep. Always get a blood sugar on your stroke patients.
Listen, we've been there. Me and her both have been there. We've called a stroke alert on somebody's blood sugar who was 40. All right? Don't do that. You look goofy. Trust me.
How low is low blood sugar?
So normal,
Mine yesterday
depends
was
on the
50s.
book that you read. 50s is low. Normally it's like 60 or 70 to like 100 or 120.
It depends on what book you read.
Yeah. All right, so then you have your endocrine system. Our glands secrete the hormones. We talked about this on Tuesday. They send those chemical messages where they need to go to control your body functions. So organ or gland problems, it can be present at birth or it can be due to illness. Graves' disease is too much thyroid hormone. And then like you have hypothyroidism, not enough thyroid hormone. So not enough hormones as well. Type 1 diabetes, what hormone are they missing in type 1 diabetes? Insulin. We have adrenal insufficiency. I think somebody's important kid died, so they really try to drill this into your brain. With the adrenal insufficiency, a lot of times if they're diagnosed with it, they have a vial of this stuff with them. And it's basically like a steroid that you can give them, but it helps with that adrenal dysfunction. So
I've been doing this for almost a decade, and I have had one patient in the back of my ambulance that had this issue. And fortunate for me, he did not have his little cellular cortex thing. So that was a whole thing that I tried to figure out on my own. So it's not super common, but apparently it's becoming more prevalent, and they are really hounding this in. So.
So then we have our digestive system. So our esophagus, stomach, whenever it gets overinflated, that's what causes your patient to puke on you. Your intestines. So that's where we do all of our digestion. So food, water, all of our stuff. I don't know why I did that. All right, so digestive dysfunction. You can have like bleeding into your digestive system or a GI bleed, gastrointestinal bleed. A big sign that you're going to see with that kind of stuff, obviously, vomiting and diarrhea. It's going to be like this. If it's a lower GI problem, their poop might look like grape jelly. That's the thing. It can be bright red. It can be dark. This is what we call coffee ground emesis. So emesis meaning what? Vomit, yeah. So if it's coffee ground like that, that means that they're bleeding into their stomach. If they're vomiting bright red blood, that's another problem. And most people cannot fix that in pre-hospital. You just drive really fast. But yeah. I will say GI bleeds, out of everybody that's ever like actively died right in front of me while I was taking care of them as a patient, 2 out of 3 of them, of like the medical patients, not trauma patients, we're not counting those, have been GI bleeds. So they will crump on you very fast.
Really fast. Like sitting in this chair talking to you, everything's normal, dead.
Mm-hmm.
And that's how quick it happened. It was like a 5 minute from.
Because they've been bleeding for a while and had no idea.
And that could be a problem, right? If they've been pooping blood for a while or vomiting blood, or they just had an excessive amount at one time. And then, their blood pressure is a little soft and then they die on you pretty quick.
Mhm.
So,
Yeah. All right. So we have our immune system, fights infection.
yep, triple A's. CJ just said. Anybody know what triple A is?
Aortic aneurysm.
Specifically where? If it's a triple A, it's specifically in one spot.
Abdominal.
Abdominal aortic aneurysm.
What do you
That's
do to
also-
fix that?
That's also drive fast.
Nothing. You just pray for Jesus because they go.
You literally keep them calm and drive fast.
And miss the bumps.
Yeah.
Don't hit the bumps.
All right. So hypersensitivity, that's an allergic reaction. If someone has a hypersensitivity to something, that's an allergy, right? So exaggerated immune response. This is a pretty good one. I wouldn't want my eyes to swell up like that. Yeah. And that's it. Does anybody have any questions?
What time is it?
7-Eleven.
Ooh, that PowerPoint took, I
Do
think
we
there are
have time?
technical issues. There's 20, how many questions?
I don't think
I don't
so.
think we're gonna have enough time. I don't think we're gonna have enough time for cahoots tonight. Sorry, y'all. Hopefully our little technological issues are solved on Tuesday.
Yeah. So do y'all have any questions about the stuff we went over tonight? That maybe somebody in this room can answer. We have a neurologist, cardiologist, a little man,
So I know this is like out of our scope.
doctor.
But all the 12 lead does is just detect that conduction
Yeah. So
system of the heart.
essentially what a 12 lead does is pick up the electrical activity in your heart.
But it's like different views of your heart. So
Yep.
like you have the different stickers are kind of like taking a picture of this part of your heart.
Yep.
Like one's looking here, one's looking here, one's looking here, one's looking here, and all the way around, and then across, and then down, and then across this way. So each lead tells you what part of the heart you're looking at.
Like your nodes and your bundle and
Yeah.
Okay.
Yeah, because you can have like a bundle branch block. You probably heard that term, like a left bundle branch block. That's where like one of these branches that comes down, you have a left and right bundle. It's blocked so that electricity comes down, says, oh, I can't go that way, comes back up, and then goes back around.
And depending on which one it is, that's how you know.
You can see it on the 12 lead, yeah. And then like if this part of the heart's affected when you're looking at a 12 lead, that the leads that you put on the electrodes are going to correlate to that part of the heart where that infarction is happening or ischemia. You can see both ischemia and infarct on a 12 lead.
I know we can't.
Oh yeah. You must have ate you
I love
something
that.
good and
If
spiked
you ever want
up.
to sit down and go through them, I got it.
Oh, go ahead.
Is anyone feeling overwhelmed?
It's overwhelming, but it's a lot of information.
It is, and you got to realize that you're learning a new language, right? Especially if you don't have any training like anatomy and physiology, pharmacology, med terminology. Like you were essentially learning a new language in 2 months. It's okay to feel overwhelmed. You should, because this is not right. It's a new language. It's like drinking out of a fire hose that doesn't stop. Even when you're full, you're like, I'm done now. I'm done, and it keeps coming.
Mm-hmm.
Right? But like they said, it's 2 months, right? You're gonna do some hard learning for 2 months, and then we're catching everything up on the backside. Where you guys start to struggle, we'll go in and help you through that. That's why if you look on your schedule, there's so much for like test prep and revisiting these things. It's okay to feel overwhelmed. Just realize at some point you're gonna sit down and be like, oh shit, it clicked. I get it now. You're not going to feel that right now. You're not going to feel that next week. You're not going to feel it tomorrow, but you will feel that. And when you do, you're going to be relieved and this feeling is going to go away. What I can tell you now is you have two options. You can either bow out and let it win, or you can gangster the fuck up and push through it. Okay?
Listen, we've all been there. I know there are people in this class that have been exposed to this in some degree, some manner. So some people have a little bit easier time. When I come into this, like I told y'all at the beginning, you know, I grew up in a family of EMS. I grew up in a family with firefighters. But for her dad's a pilot and works at a mine, and her mom was worked in a lunchroom at a school, right? So when she started this was her first experience to it, right? Calvin over here, same way. His dad works at a mine. I don't know where, or works at the nuclear plant down here or the power plant, whatever it is. And I don't know where his mom works at, but she's not in this, right? And so for a lot of us, this is all new information. We understand where you're at. We know where you're at. If you're struggling, if you're having a hard time, just come talk to us. Like I said, I work 4 days every 2 weeks. I'm at that station almost every day, and everybody in here can attest to that sits at that station. Me and her are at that station almost every single day. If you need us, reach out. We can set up a day to go over stuff with you. We can set up a day to try to help you understand it better, because I don't want you to fail out for a couple of reasons, right? If you do good, that's great. You can go back to the mine and treat people appropriately. You can go back to the sheriff's department and treat people. You can go to BLM and treat people, right? But even further than that, and I say this as kindly as I can, if y'all do good, it makes us look good. Right now, GBC and Humboldt County, their programs are failing, right? If we have a passing program, then it allows us to teach more of these classes. It allows us to get the community involved more, and we can advance this process, right? We can do a couple of EMT classes and then do an advanced EMT class, do a couple of advanced EMT classes, then move on to do a paramedic program. But if we don't help y'all succeed, then we never get to that point, right? Because the county commissioner is going to be like, well, what the frick did we just waste all this goddamn time and money for? Like y'all everybody in the class failed. So we want y'all to succeed. We want y'all to do good. So if you're having a hard time, if there's anything you don't understand, if you need extra help, we are available. We live here. Mike and CJ live here. Hannah's I think the only one that works for us full time that doesn't live in town. But if she's on shift, I'm sure she'll be happy to help any way she can. So reach out. Let us know. I know the study groups are awesome. Marigold's got one going on. And do that, right? I know y'all have one going on too, right? Like, do that. Get with people, sit down with them, go over this stuff, right? And if you have questions, don't be afraid to ask. If I don't know the answer, if Becca can't answer it, if Mike can't answer it, we'll find the answer. I don't know everything. I'm the furthest thing from knowing everything. Becca doesn't know everything. Mike and CJ have been doing this for a while. We've got probably, close to 40 years of experience sitting right here in the front of this room. And so if we don't know the answer, we'll find you the answer, right? So don't be afraid to reach out. It's 2 months. Like Mike said, gangster up or let it beat you. When I started EMT school, I worked for 4 different fire departments and went to EMT school. So I get it. I mean, it's rough. It's hard. It's a lot of knowledge. It's a lot of information in 2 months, but you just got to kind of power through it and get through it the best you can. So
we also are recording all these classes too. So if you think that maybe just rewatching these classes will help you out, I can give you guys a link to these, okay?
Yep. They are on CJ's YouTube. He can send them to you, and you sit down and just rewatch them. I learn from the repetitiveness of it. So
repeating something is the only way of beating the fire hose feel.
Mm-hmm.
Just because you didn't catch everything the first time doesn't mean you won't catch a few more things. There will be an area like you mentioned returns where you're not going to get it. So that's where you get the idea of a different media format receive this information and have it stick better that next time.
And if you have a certain way where you learn better, I know the first few chapters are hard because it's hard to not do so many PowerPoints for this kind of stuff. If you have a certain way that you learn better and you need us to kind of adapt and, change, we are willing to work with you guys too.
Yeah, we want y'all to succeed. Mainly because we don't want y'all to walk out of this classroom and then when you go and do something and they'd be like, "Who the frick taught y'all's EMT class?" We don't want to turn around and be like, "It was us."
So listen, if you have an OB patient and they're bleeding out,
Don't stick your hands in females'
When
parts.
this class ends, if y'all want to hear my big blender story, I'll tell you.
But yeah. Or at least while we're not recording, so Austin can hear it too. But yeah, guys. So everybody is doing pretty good thus far, but we just got through the easy part, and it doesn't get easier. No, it doesn't. It doesn't get easier, right? And it shows, just off of your own self drive. And what you're doing in your free time and what you're doing in your off time and how much studying you're doing. And I want everybody in here to succeed. And I want y'all to do good. Because I remember when I was just a little EMR firefighter and I thought that I knew everything in the world and I didn't know anything. And I still don't really know anything compared to a lot of people. So, yep.
Cool.
Y'all have any questions, concerns, gripes, complaints? Nope. Perfect. If you don't forget, what's today, Thursday?
Yeah, go ahead.
You got a class or you got a test on Tuesday. You got drug cards due by the 27th. Do your homework assignments, your pretest assignments. And yeah, if there's anything else, we'll reach out to y'all and let you know.